Hello students. So today we are going to see about conducting a health camp. So in last class we completed with the clinics. So in the camps we are focusing more about general aspect and the audience are of all age groups. So we have to set in such a way that all the resources, man, money, material, everything will be a little more we needed for while conducting this camps and all specialty doctors, lab facilities, medical facilities, pharmacy, everything must be ready priorly and pre-preparation has to be done. You have to work homework for setting this camp. You have to arrange all the things and local people can be called for, and informed about this camp ahead. For example, 1 month before itself you can give advertisement about the camps that is planning to be conducted. Ask the help of local leaders and NGOs to get canvassing more number of people getting into the camp. Only then the camp will be successful when lot of audience are reaching and we could be able to get grow a large number of people. Then only the camp seems to be successful. So what are the things you have to keep in mind prior itself while conducting the camp? That is, fix the location, date, frequency of conducting camp. So always see that once we conducting camp, we are stopping not from time being we are not conducting any more, then there is no continuity of follow-up in health services. So always see that frequent basis you have to at 6 month, once in 6 months or once in 3 months, in that way you have to conduct the camp. Then only you will get a target audience and you will get a follow-up of health services. Otherwise just conducting and they also will leave not showing to any other doctors and only when there is a acute situations the local community people will go to health for health checkup or continuity of health services. So to prevent that on frequent basis we have to conduct the camps. So you have to keep in mind all these aspects. Estimate number of candidates could participate in the camps. Always you must keep estimate accordingly. You have to get the equipments and supplies ready for the target audience. Providing the medical supplies like screen, chairs, refreshment, etc. You have to keep it ready. Publicity by announcement, distribution of handouts or notices, materials aviate materials you can use for advertising prior itself about the medical camp and you have to provide the announcements. Brief report of the data as required for the health services. So after the completion you have to give a prior you have to prepare a report and it has to be submitted to the health authority. Prior itself you have to inform the health authority that your team or your organization is planning to conduct such a camp, and you can get a help from these health centers or nearby hospitals. The specialty doctors and other paramedical staff can be called for help during the conducting of health camps. So in that way, prior and after that also you have to inform the health authority. Camp and community mobilization. Camp is useful community mobilization as well as marking tool. So it is important that in frequent basis you have to conduct the health camp. Then only health of the community people is assured, and it is the responsibility of the community health nurse on frequent basis to be these health camps has to be conducted, because there are still many remote areas where even there is no health centers or dispensaries nearby. They have to walk lot and lot distance to even go to some dispensaries or clinic. So it is very important to conduct any of some camps and clinics in nearby in their area so that we can assure the health of this community people. Disadvantage of this thing is that patient is not making it a referral clinic. So because sometimes we are identifying any of the NCDs or any health issues are being identified, then we are being referring to nearby health centers. Sometimes these people will not go to the referral centers for continuity of health services. That is one disadvantage, and sometimes we couldn't follow these individuals because huge number of people are coming to the camp, so it is not possible to get a mark of these people. Usually we are getting their addresses, phone number and all to check on the continuity of services, but still sometimes we could not get through the individual. So referral and continuity of the services is not assured in this method. Process in health camps. Mainly it is gender balanced and structure, name, appearance and location of the camp does not create any problem to the candidates. We should not keep General basis we have to keep on all age group, and we have to keep the camp. So that more number of cases we can able to identify. Instead of that, if you are keeping family planning camp or STD camp, in that way, if you are keeping, the participants will be very less and they will be hesitating to come to this camp. So always keep in a general basis, we have to keep the camp. So anyone or any age group can be come to the camp and get the health services. But in between, we can keep in mind of our target audience, and accordingly we can provide the services. For example, our target is to identify reproductive tract infections in the community people, or STDs among the community people, or family planning users among the community people. So, but it is in general basis if we are keeping, or specific basis if we are keeping, we may not get sufficient audience. But the volunteers and health personnel can always keep in mind about this focus, and in general basis put a name and call the call for health services, but indirectly you can get the data needed for STDs and other aspect you are focusing on. In that way only we can get or scrutinize the health aspects. All forms of communication must be acceptable, because sometimes illiterates are also will be coming to the camp. So all types of language or communication form you must be trained with, and you can ask them to get, you should know the local language to speak on with these community people, and always understand their problems, identify it, solve their needs and issues that is faced by them. Good interaction between and within the health workers and client is very essential while conducting the health camps. Adaptation of the camp. Good space and location must be set. Separate entrance and exit point must be kept so that there will not be a crowding. Privacy must be maintained. So these are the basic things that you have to set in the mind. What are the points that you have to keep in mind to make the camp successful? Organize a camp on holidays or weekends, and always with some other event, and join it and conduct the camp so that you will get more participants. Medical camp should be like general health types, avoid HIV, STI topics. That is what I told. You can focus indirectly into that. Take help of a Red Cross authority, Rotary Club, NGOs to impart some credibility to camp. So recently in last year we have conducted one health camp in the health center. So our focus was perhaps to identify cervical cancer among the women, risk of cervical cancer. For that we have to conduct, or we have to do a pap smear. So generally if you are saying cervical cancer camp, nobody will come to the camp. So in general aspect we are conducting, especially along with NCD clinic we have conducted this. So NCD clinic is the age group from 30 above, ladies and gents are coming, and in that target audience, from that we are calling all the ladies for checking their pap smear and also breast self examination to identify any lumps in lumps, and also in the early identification of cancer, cervical cancer, breast cancer. In that way we are doing it. So so we got a sufficient number of audience for our target people for the camp. In that way only we could able to conduct. Otherwise generally in single aspect if you are keeping, we will not get sufficient participants. Carry lot of medicine free to the patients, especially sample medicines. So because they are very much poor people, they will not have money to pay and get the medicine. So we should have make the arrangements to get some free medicines to supply for these poor patients. Through camps, referral services can also be done. You can refer to nearby health centers, try to get their addresses and contact numbers, follow up and to get the continuity of the referral services. Publicity prior days of workshop or camp, you have to conduct the publicity through announcements and through handouts. The advertisement can be done with the help of pamphlets, loudspeakers, banners, run an ad in radios and TVs. Pre-camp or press notice can be given. So small. So these are the advertisement aspects we have to do. While conducting the camp, you can keep a small opening ceremony, calling the local leaders. Thereby, more announcements can be given. A brief introduction with the help of local leaders, so that more community people will be motivated to come to the camp. Avoid crowding. Do the camp in a systematic way. Provide brochures and reading materials to the patients generously. Follow a camp with a press conference. Don't